And respond.
Honorable Chair, well, when I was mentioning some of the things that are causing the rise in numbers, I did not mention witchcraft because, to be honest, I do not know much about witchcraft. Ours is scientific. I agree with you.
We are dealing with the realities of life. I don't want you to be evasive. Abantu baloga edogo jeriri. So I want to know whether in your diagnosis and management you have yes, are there instances where you are dealing with a dogo?
Honorable Chair, I think every day is a learning day. We are looking forward to when we shall be educated on those ones. However, we are also thinking that we should work collaboratively with alternative healthcare providers. Maybe they can provide something other than what we provide. But we need to go in that class and learn the lessons, Honorable. I cannot speak to that.
Mention this parliament here passed a law to regulate not witchcraft per se, but traditional medicine, herbal medicine, and management. But this Basawa Basoga, what you call Basawa Baganda, there was an attempt to have them regulated, because you recall, colleagues, in the 10th Parliament. Yes, we passed this law here. So I don't know how it impacts your work, but as you said, maybe it is something for another day.
Yes, Honorable. We are hoping that we can, if we become an institute, maybe we can do some innovation and look at some of the herbs they're using. The alternative providers, I don't know whether they are Balogo, but they are herbalists, and then they are the spiritualists. Are they witches? Okay, spiritualists and herbalists.
Even if they are witches, Chair, again through you. The Bazungu, when they were here, they actually made for us a law called the Witchcraft Act, in recognition of those services and the circumstances. They were Bazungu, the colonialists, and they left here that law, the Witchcraft Act. So, Director, don't take it lightly. Yes.
Honorable Member, you are very right, and that's why I said we need to become an institute and we investigate some of these things and we innovate. Maybe there are, things out there in Busoga or wherever that we can use here in Uganda to treat, to get medicine out of them. So we are not brushing these off. We know that it can be an opportunity that we can explore. But we're not yet there. We need to explore.
In simplicity, as you interrogate with patients, haven't you because I know Butabika does research, and also as patients come in, before even you go into the scientific investigations of what has caused the illness, you normally ask them. Then you tell but haven't you ever recorded such cases? Because as Honorable Asman says, we must face some of these realities. You see, so it's something that you should take interest in.
Yes, Honorable, we will. The reports always come. It's just that we cannot measure it. So that's why we can't report on it. But we do get reports.
So,
one more question, Honorable Chair.
Yes, Doctor.
About
mental cases. I'm seeing Dr.Naku being an incubator of mental cases, because if you have a doctor who is supposed to operate on 30 patients and is operating on 100, and a nurse who is supposed to take care of 10 takes care of 50 to 60, don't you think you are also contributing to mental illness in this country? Because this is super overworking somebody. So we might also have casualties on your side. So you need to comment on, because really you are an incubator of mental illness. How can a doctor who is supposed to work on 30 patients work on 100? So you need to update us on that. Number two, these escalating levels of mental illness in children, 22.9% in children is simply too high. What are the causes in children, and how do you advise us as parents? What should we do? Because 22% is simply too high. Then do we have a policy? Have you implemented the policy of integrating mental health services into the primary health care? And this investing in training in communities, but more especially the policy of integrating mental health services in these other health, primary health care. Then we asked you what would be the most appropriate budget for Butabika National Referral Hospital. You were silent on that. You can also tell us whether you are comfortable or not. But if one gave you an open check and asked what would you be the most suitable budget for Butabika National Referral Hospital for you to be able to give quality and timely services to the people. So if we are to give you an open check, what would be the most appropriate budget for the functionality of that health facility?
The patient, one of his sons, but that family every day that person they commute to Tavika for treatment for just a drug every day. Then he say, well, why can't you? I even asked him, so why can't they give for a week? Because the family is grappling with transporting that person every day. He has to go to Tavika every day. So why can't you administer like you give a week? I fail to understand because that's what they do.
And you also need to update us. We are normally told that has increased. So how many did you register? Give us an update. And do you have mental clinics for? Give us. They told us you registered very many patients. Ah, that's what they said. Because we need to prepare. Yes, response.
Increase in mental health problems, especially among young people. The causes are multiple. There's a lot of stress in the community, we believe, because of financial strain, maybe young people who have gone to school and are looking for jobs. Unemployment rates is another one. There are lots of issues in families that are breaking up, that are not supporting children well. Those could all be causes. There's also academic stress. We have been here before, Honorable Chair, to talk about the school programs that do not allow young people to rest enough. You know, there's prep starting at 4 a.m. and the child has slept at 11, then they are up at 4 a.m. to go to class. We've talked about these things here before. So those things cause a lot of academic stress, but including the expectations, academic expectations from us, the parents and the communities. Yesterday on the news, I heard there was a child, an S6 girl who scored 19, but committed suicide because she was told she should have scored 20 points, and a scientist. That was in Masaka region only yesterday. So these cases are many, and we need to support our children. So it's a multiplicity of conditions, not to mention the alcohol and substance abuse problem, Honorable Chair, which has become an epidemic. About 25 to 30% of the patients who come to Butabika Hospital come because of alcohol and drug abuse, and they're all young people. So this is an area we need to work on, and they start very young in school. So what can we do about this? I think there are many things we can do. To start with, we are trying to spread out the services so that they're not only at referral hospital centers. That services should be everywhere. And working with the Minister for Health, who was very supportive, Dr. Gina Cheng, we have expanded the staffing norms for all health centers to include social workers, counselors, and psychologists at those levels, health center 3, 4 district hospitals, other than the regions, so that people can get help early within their communities before they decompensate so severely to come to Butabika. That's what we recommended. And those positions are there. So what we need to support with, Honorable Chair, is for Parliament to lobby for us so that the other hospitals and health centers can have the wage to recruit those staff so that the population can be supported. The other thing we could do is to look at school mental health. And we've worked closely with Ministry of Education. We have developed guidelines to help schools be able to provide mental health care within the school setting. If that is widespread, it should be able to help students. There's a lot of health in schools that is lacking mental health, actually. And that is what we found in our research recently. So that needs to be pushed so that schools are mandated to provide mental health support to their children, not only the children, to the teachers as well. So if we do those things, then maybe, and then integrate these services, we should be able to support as many young people as we can. But that goes with integration of care into primary health care, Honorable Chair, which you were asking about. I'll jump to that question. There has been effort to integrate mental health care into primary health care. The health sector, the health policy and health sector strategic and investment plan has embedded mental health to be provided at all levels of care. So if we ride on that and we have the finances to support that, recruit the staff and provide that care, that should help. Even the children, so we need to integrate this. Even the children who come from schools, because they live in areas that have health centers, can use those services. So the framework, as I said, is there. The policy, regarding the policy to retain best students, unfortunately, we can't do that because we're not a university. We are a Ministry of Health institution. We would wish, if we became an institute of mental health, that would be possible. And we are pushing to get there. But now we are a hospital, and we don't have the mandate to do that. We wish we could. And because we don't employ the people. We get people brought to us through the Health Service Commission, generally. Then availability of professionals in the districts and regions, that's what I just talked about. The structures have been expanded. We need the wage very urgently to get those people in position. If we got that, that would work very well. Honorable Chair, we actually may be contributing to what is called burnout. Burnout is that condition in any workplace where if staff are severely stressed by the conditions of the workplace, they get burnout. Burnout leads to depression, anxiety, suicide, alcoholism in the workplace. So we need, if we are going to help our people, we need to also mandate workplaces to incorporate mental health care for their staff. Every workplace should have a mechanism to do that. At Butabika, Honorable Chair, while we are not incubating this, we are trying to help our staff. We have senior staff, we have a principal clinical psychologist, and Dr. Mtamba seated here next to me, and other senior doctors who try to help our staff who may have a challenge. We do that in-house. We wish that every workplace, including Parliament, should have a mechanism to support their people, a formal mechanism, so that people do not break down under the weight of their work. So what are we doing to sensitize people? Honorable Member, we've been on media, including social media. We now have a part-time communications officer who is helping us do some communication. We are a lot on social media. We have a call center. In that call center, we curated mental health information, recorded it, and put it in the call center. It uses, for those who are IT savvy, an IVR system. So when you call, the call center will ask you whether you want to listen to a number of things: depression, childhood conditions, addiction problems. So you choose the number and you listen. It will give you the information. For that condition you have chosen.
Yeah.
I would encourage, Honorable Chair, that all of us call into our call center. It has information for the public. Anybody can access it. However, we are also going out to media. When we have, say, World Mental Health Days, we're out there talking about mental health. We have May is coming up. It is Mental Health Month. We go out there and talk about it. We've been on media several times, but we're continuing to do that.
Chair, the call center, I don't think my mother down there in Muria can pick this, because even seeing her phone, apart from the button for receiving, I don't know whether she knows any service on the phone. So when you talk about the call center, I don't know how people who don't use these social media platforms can get, because this information should strictly be for the general public out there, who are not, well, some of us to get it. But what about the local person down there who can't use even a phone, who doesn't even have a phone? Because there are people still who don't have phones. Me, I would think that you can get a day. Don't wait for May. At least once in a week, there should be somebody to talk about mental health. Maybe there should be a counselor, maybe on a top radio, and the top radio covers the whole of Teso sub-region, and then you have another radio somewhere. And I mean, you disseminate the information so that people pick whatever they pick. Some people utilize it, and it reduces on your burden here. Yeah.
I can't agree with you more, Honorable Chair. But these places, so that when you have a councillor sitting in Amuria, they can speak Ateso and communicate. When you have another one sitting in Luengo, they can speak Luganda and communicate. The call center has only English and Luganda. It is not social media, it is telephonic. But we need people to do these things. And I hope we can get them.
Thank you. Yes, Honorable Basman.
Ask the accounting officer here. Are there mentors at Daru? Is it something that you manage your experience? I want to understand from you.
So as you do and respond.
Honorable Chair, well, when I was mentioning some of the things that are causing the rise in numbers, I did not mention witchcraft because, to be honest, I do not know much about witchcraft. Ours is scientific. I agree with you.
We are dealing with the realities of life. I don't want you to be evasive. Abantu baloga edogo jeriri. So I want to know whether in your diagnosis and management you have yes, are there instances where you are dealing with a dogo?
Honorable Chair, I think every day is a learning day. We are looking forward to when we shall be educated on those ones. However, we are also thinking that we should work collaboratively with alternative healthcare providers. Maybe they can provide something other than what we provide. But we need to go in that class and learn the lessons, Honorable. I cannot speak to that.
Information, this parliament here passed a law to regulate not witchcraft per se, but traditional medicine, herbal medicine, and management. But this basawa basoga, what you call basawa baganda, there was an attempt to have them regulated, because you recall, colleagues, in the 10th Parliament, yes, we passed this law here. So I don't know how it impacts your work, but as you said, maybe it is something for another day.
Yes, Honorable. We are hoping that we can, if we become an institute, maybe we can do some innovation and look at some of the herbs they're using. The alternative providers, I don't know whether they are Balogo, but they are herbalists, and then they are the spiritualists, are they witches? Okay, spiritualists and herbalists.
Even if they are witches, Chair, again through you. The Bazungu, when they were here, they actually made for us a law called the Witchcraft Act, in recognition of those services and the circumstances. They were Bazungu, the colonialists, and they left here that law, the Witchcraft Act. So, Director, don't take it lightly. Yes.
Honorable Member, you are very right, and that's why I said we need to become an institute and we investigate some of these things and we innovate. Maybe there are, things out there in Busoga or wherever that we can use here in Uganda to treat, to get medicine out of them. So we are not brushing these off. We know that it can be an opportunity that we can explore. But we're not yet there. We need to explore.
In simplicity, as you interrogate with patients, haven't you because I know Butabika does research, and also as patients come in, before even you go into the scientific investigations of what has caused the illness, you normally ask them. Then you tell you, but haven't you ever recorded such cases? Because as Honorable Asman says, we must face some of these realities. You see, so it's something that you should take interest in.
Yes, Honorable, we will. The reports always come. It's just that we cannot measure it. So that's why we can't report on it. But we do get reports.
So,
one more question, Honorable Chair.
Yes, Doctor.
About who has to visit Butabika Hospital every day for medication. We have a type of treatment called the medically assisted therapy. I would ask Dr. Mtamba to speak about it. This is the one that requires a patient comes to hospital on a daily basis. He's the head of that unit.
Thank you, Honorable Chair. To the Honorable Member, as mentioned, we have a super specialized clinic at the hospital called medication-assisted treatment therapy for individuals who have substance use problems, specifically those who are addicted to a class of addictive drugs called opioids. And these are required to come in on a daily so that they have a directly observed treatment, because we are trying to treat them for their addiction using a less potent, more efficacious and safer drug to get them off the drug that they are addicted. But we need to observe and monitor them on a daily. And the MAT clinic, as we call it, is the pioneer clinic in the country. And so it has been the only one in the region and in the country, apart from the one now started in Mbale. And so it requires individuals to come in daily. And that is that's the only clinic probably that would require someone to come in for individualized care on a daily basis. But it is necessary for them so that we can monitor how they are responding. Because since they are outpatients, we need to know how they are responding to this medicine and if they are getting any other complications. So that is the only clinic or service that I would imagine where a patient would come in on a daily to receive care as an outpatient. Otherwise, they would probably need admission.
And also, that the medicines we give them are controlled drugs. If we give them for a week, or the people are going to abuse them. So we give them under controlled circumstances. It's a highly specialized area. That's why they have to come in on a daily basis.
Madam Chair.
Yes.
Thank you very much. I